On July 11th, 2019, we received a complaint from a member of the public regarding Kawartha Endodontics. And our inspector and public health nurse carried out an inspection on July 15th. They did find several deficiencies related to the cleaning and the sterilization of the dental instruments. And these were significant enough that an oral order, a Section 13 order, was issued to the dentist to close the practice immediately. And so that occurred. The practice was closed. July 16th, we delivered a written order to the dentist. We did go back. They asked us to go back a couple of days later to see if they had been able to address all of the issues. Unfortunately, we did conduct a re-inspection on the 18th, and the premise was not approved for reopening. On July the 25th, we did do a final re-inspection, and at that time, we confirmed that all of the corrective measures had been taken and they were cleared to open. The closure order was rescinded on July the 26th. So following our closure of the clinic, I did learn that in fact the Royal College of Dental Surgeons of Ontario had gone in and done an inspection at the clinic in 2016 in response to a patient complaint. We weren't involved at the time and certainly didn't have knowledge of this, but I did request that the college release that report to me. We did get a copy of the 2016 report. We found 12 deficiencies that were noted at the time. And so because of that, we had no confidence that there was ever a time when this practice was practicing within the guidelines. When these sorts of lapses occur, typically what happens if the risk is significant enough is that we work with the operator and we contact all of the patients who potentially were exposed, and we provide them with information. We give them a letter that they can take to their physician or nurse practitioner, and we give them a testing requisition slip so that they can be tested for blood-borne infections if their health professional advises them to proceed. Now, we did then, on August 27th, I personally met with Dr. Kalislian and served her with a Section 13 order, advising her that we were hoping we could partner with her to do this direct patient notification. And on the 29th, we updated we just revised it because we had missed a field. We needed date of birth, but essentially it was the same order. And since that time, we have been unable to achieve her cooperation. In fact, she has appealed our order to the Health Services Appeal Review Board. We have a hearing that's been tentatively scheduled for mid-January. And given the number of witnesses that they plan to call, we don't anticipate that we would have results for months, if not years. And so because of that, we have made the decision that that was too long to wait and that we needed to proceed with the mandatory public disclosure, and that is why we have called you here today. The concern is that there were medical devices that were not cleaned or disinfected properly, and that when that happens, this can expose individuals to bloodborne and other bacterial pathogens. The bloodborne infections, the viruses that can only be transmitted through blood or bodily fluids, are hepatitis B, hepatitis C, and HIV, which is the virus that causes AIDS.